Absolutely.
Yes.
Yes. It's not as standard as of yet, but I would say that across the country, there are opportunities for nurse-managed or nurse-led clinics where nurses provide primary care. And some of our federal in the United States, our large governmental entities recognize nurses as providers for primary care and in nurse-led clinics. The issue, I think Dr. Karlowicz mentioned it, she talked about physician collaborators. Because we are 50 small countries or states, some states there is no need for physician collaboration or regulation. And in others, the nurse has more restrictions on the practice and is not as free to have a nurse-led clinic or a nurse-led primary health care center because of the regulatory issues related to physician collaboration or oversight. And that's because of the 50 small states.
On the other hand, the United States is not producing enough physicians, and so therefore in the rural areas where there is a tremendous need for healthcare services, that's where nurses, especially advanced practice nurses, are filling the gap. And so we've had many of our graduates from our master's and our Doctor of Nursing Practice program sort of think outside the box, look at what the needs are in their respective communities, and have set up individual nurse-managed, nurse-conceived healthcare practices to meet the healthcare needs of the rural population. And they're doing that independently. I'll give you my very basic answer, and then I'm going to let Dr. Adams Tufts do a more complex answer. I will tell you, there were a lot of naysayers in the United States about the Affordable Care Act. And the reality is there were hundreds of thousands of people who signed up for affordable care. People like my manicurist who did not have health care insurance. Finally, she had a way to get health care insurance that was affordable based on her income. You know, people who are in self-managed businesses, small businesses, service providers who, you know, the person who cleans my house, people who were not affiliated by employment with a large organization who provided even limited access to health care insurance. So from my perspective, it's been a tremendous success, despite what the government leaders are saying. The fact is that many people took advantage of it in much larger numbers, and now there are people who have got insurance who are eligible for healthcare services, which is why we need more nurses to provide those primary care services, because there are more people who are insured who need the healthcare services. So from my perspective, it's been a tremendous success. I think some of the negative press that you've heard about the Affordable Care Act is because healthcare delivery or healthcare insurance didn't ultimately follow the path that how others wanted it to be. They had a different model in mind. They had a different kind of funding in mind. When it didn't go their way, they became very negative. But when you look at the thousands of people who have accessed it and what kind of jobs they do and why they needed that kind of insurance, it's a success from my perspective.
I agree. Remembering that we had somewhere between 42 and 45 million people who were uninsured or underinsured. So now we know there are 17 million additional who have insurance. Okay, so we still have some, about half, but to have 17 million that now have access, because remember, it's not health care reform as sometimes we say in the United States. It's not. It's insurance reform. And so that's probably some of the naysayers, because with insurance reform and more regulation of the insurance companies, oh, you can't say, you had a mole 3 years ago, so now that's a pre-existing condition, and now you can't have treatment for skin cancer, or those kind of things. So it did away with pre-existing conditions. So they think I'm not being able to get as much gain from that. Or because if I don't have to treat these people, then I get more profit, right? Or other pre-existing. It enabled parents of young adults and college-age adults and young people to be able to have coverage for their young adult and children from 18 through 25, right? Whereas before it was 22, and so I guess it's 27 now. I'm forgetting. 26. So when you turn 27, you're off. Yes. So he expanded that. So there's a lot more people who it covered for insurance purposes. It has flaws because the whole Affordable Care Act of 2010 was a compromise. It was not what was proposed to have a broad, expanded, universal coverage for all. It was a major compromise, so it's not perfect for the ones who wanted universal access, and it may be a little bit negative for those who thought, I don't need the insurance agency or industry to be regulated.